Lifting the brows softens your entire expression. By repositioning the brows upward, that crowded skin unfolds naturally, making your eyelids look defined and less bulky. Hello everyone, welcome back to my channel. I'm Dr. Jason Suh, a board-certified plastic surgeon and medical director of Eyelid Plastic Surgery. During my consultations, one of the most common concerns I hear from my patients is, Dr. Suh, my upper eyelids always look so thick and heavy. Can you just remove some fat during double eyelid surgery to fix this? Or, my eyes look so small because of this puffiness. If you've been looking in the mirror thinking your puffy eyelids make you look tired or heavy, you're definitely not alone. And like most people, you probably think that excess eyelid fat is the main culprit. But is it really? Today, we're going to break down the real cause of upper eyelid fullness, why jumping straight to fat removal can actually be a risky move, and what you should do instead. Let's bust a major myth right away. Upper eyelid fullness is really just about fat. In fact, taking out too much fat can disrupt the natural balance of your eyelid. It can lead to an unnatural, hollow look, or worse, create internal scarring that actually restricts how your eyes open and close. Now, don't get me wrong. There are cases where orbital fat, the fat that cushions your eyeball, actually protrudes because the supporting tissues are naturally weak or have aged over time. But these cases are actually quite rare. So, if fat is the problem for most of us, what is? The real answer is surprisingly simple. It's thickened upper eyelid skin and brow descent. You see, your eyelids and your eyebrows are closely connected. As we age, or even if you're just born with naturally low brows, the eyebrows gradually shift downward. This is called brow ptosis. When the brows drop, all the skins get crowded and bunched up right above your eyes. It creates a heavy, hooded look and can even cause you to constantly use your forehead muscles to pull your eyes open, leading to deep forehead wrinkles. So, if excess skin redundancy is the real issue, cutting out fat won't solve it. The solution? We need to lift the roof. This is where a Scarless Brow Lift, also known as an Endoscopic Forehead Lift, comes in. Here at Eyelid Plastic Surgery, we perform this procedure using an advanced endoscope. This gives us a highly magnified view, up to 50 times greater than the naked eye. Because the brow area is packed with crucial nerves and blood vessels, this level of precision is crucial for safe surgery. By using tiny hidden incisions, tissue trauma is minimized. For you, that means a much faster recovery, less swelling, minimal bruising, and most importantly, no visible scars on your forehead. So, what kind of results can you expect from an endoscopic forehead lift? There are 4 major benefits. If the distance between your eyes and brows is too short, it can make you look stern or angry. Lifting the brows softens your entire expression. By repositioning the brows upward, that crowded skin unfolds naturally, making your eyelids look defined and less bulky. Once your brows are back in their useful position, you'll stop unconsciously straining your forehead muscles. It lifts that sagging skin, helping your eyes look wider, brighter, and refreshed. A successful brow lift requires a deep understanding of facial anatomy and intricate surgical experience. It's about finding the exact underlying cause of your concerns and tailoring a plan that gives you both functional comfort and natural-looking beauty. If you're tired of heavy, puffy eyelids and want a professional, personalized evaluation, come visit us at Eyelid Plastic Surgery. We'd love to help you rediscover your brightest eyes. Thank you for watching. If you found this video helpful, don't forget to hit that like button, subscribe for more expert beauty tips, and I'll see you in the next video. Bye.